let's start off. Here we go. We have, of course, the back and the front. Okay. We have the auricle right here, and then there's another one right here. So this, of course, is the right auricle, and this, of course, is the left auricle right here. So best way to find the blood vessels is to find what leads into the auricles. So here we have the right auricle. So this, which would have been leading into the right auricle, should have been the superior vena cava right here. So the superior vena cava should have been coming here. And then, of course, there's a hole right here, which would have been the inferior vena cava right there. So that would have been the inferior vena cava. Then on this side, where the left auricle is, we have a larger hole over here, which is where the pulmonary veins would have been. Now, over here, we have these two large structures here. We have this one in the front, which would have been the pulmonary trunk, and this one in the back, which is the aorta, and of course a branch coming off of the aorta, which is the brachiocephalic. Now, on here, this is a little bit trickier because you have a little bit of fat on the heart, and so what you have to start looking for are the lines, and or try to clear away the fat so that you can see a little bit better. Now, if that doesn't work, what you can do is you can kind of take your finger and go back into the auricle and then find where is the ventricle and where does it end. So right there, you can see this is where the right ventricle ends. So right at this blood vessel right here is going to be the interventricular artery and vein. So right here, going across like that. So that's where the great cardiac vein would be, or the anterior interventricular artery would be right there. And then if you go this way, you'll see that it basically stops over here. So this is where the posterior interventricular artery, or the middle cardiac vein, would be right there. And then, of course, the sinus would be up here, right in this area here. But see, they cut it so badly that you can't really see much of it, but it's like right there. Okay? Again, here's the apex right there. And I think that's it.